and I'm planning to learn new language, for example, Spanish. And also I'm going to do skydiving after, I think, in December, in January, February. And lastly,
Well,
I love to sorry. And lastly, I love to entertain myself and people around me. That's pretty much about me.
well, that's a really nice introduction. So, as you said, like you have traveled a lot of countries. So, which one was the favorite of yours? And can you tell me one experience about that?
Yes, of course. So my favorite one will be Prague, because
Mm-hmm.
first of all, it was cheap to travel there. The cost was very less, and also I went there in the month of December. So I witnessed Christmas, and it was so beautiful. All the foods and history, because it comes in Czechoslovakia, right? So it is half part of the Russia and half part, now it is a part of the Europe. So I got to meet both culture, and then we had different kinds of varieties of food. And also there was dancing, their particular dancing. And most beautiful scenario was the whole city was full of lights, because of the December, because it was Christmas.
Mm-hmm. Well, that's really nice. And you said you are learning swimming. So, what was the recent skill that you learned in swimming?
Right now I'm learning to do floating. I'm very bad at it, to be honest. Whenever I go inside, I learn like how to do, like I'm learning it in a frog position, so it is slightly tiring for me right now. It's my initial stage. But whenever it comes to
Mhm.
floating, I always immerse inside the water. I can't stay long in a floating position. So I'm learning that.
Well, that's good. And can you tell me about one of the awareness programs where you had a major role in that program and how it was meaningful to you?
Yes, I have conducted actually a lot of awareness program while I was growing up, and when I was in high school. I helped my father for the awareness program about importance of girls education. So what we did, we planned like what are the things we need to tell our community people so that they can get aware about how much it is important to give education to all the girls, and what roles a girls can also play. In my mind it was like there is nothing a girls can do that a boys can do. So I wanted to teach them in a good way by giving them some gifts, or by giving them some examples, and by showing them some model, so that they can get inspired, and they can also send all their girls child to schools. And second most impactful awareness program I conducted was back when I was doing my medical officer job in Nepal. At that time, every month our government hospital used to send us to rural area, and there we used to conduct awareness program about sanitation. For example, most of the people don't even know that after coming from the toilet you have to wash your hand, how to take proper hygiene care about yourself. And still now at this time people are using clothes instead of instead of pads. And then we used to distribute the sanitary pads for free, and also educate for antenatal care, prenatal care. We used to distribute soaps, towels, clothes, and different things. And that taught me how to work in a team, and also that taught me that even if you are changing small thing in people's life, that's gonna impact them for a long run.
Mhm. That's really good. And why did you choose to go for internal medicine?
Actually, I am choosing family medicine, not internal medicine.
That's
So
so
yeah,
sorry. So, what is the reason for you to choose family medicine?
thank you so much for asking this question. Yes, I did choose family medicine. Uh, for I have a lot of reason, but I want to focus on two most important reason. first, I come from a small town where we connect with each and every member of our town. Town people, for we whenever they need us, we are there for them. So I love the connections and long term relationship with people from my childhood. And in family medicine, we get to build long term relationship between patients and physicians. Next will be, I love the fact that family medicine provides preventive measures, and which is which I could not get in my country, because in my country we are prescribing medicine. We don't focus on preventive measures and preventive medicine. But after coming to the USA and doing clinical, after having so much of clinical exposure for 1 year and a half, I came to realize that preventive medicine can change patient's life in such a better way that in long run you are preventing them from getting the disease, getting the chronic disease. And
Mhm.
that is the most important point. And also I can say that in family medicine we have so much scope that we can do urgent care, we can have our self private practice, we can go to rural program, we can go to we can become a hospitalist. So all of these contributed for my determination towards family medicine specialty.
Well, that's good to know. And can I ask where you see yourself in the next 5 or 10 years?
Yes, I want in 5 years I'm definitely going to be a good primary care physician. And for part time, I will do job as a hospitalist. And part time, then after that, I think I'm going to start my own private clinic. After learning, after becoming a good leader, and after learning how to be a good physician from this program.
That's good. And can you tell me about a situation when you had a conflict with your resident or an attending, and how did you handle that?
Yes, I can still remember the scenario actually.
Mm.
When I was new in my medical, when I was new in my medical officer job, and I just started. Then that time, it was only a month. I joined my hospital, and then one of my senior, I can't say colleague, but one of my senior, he always used to taunt me like in a different way. He used to be very rude with me, like, hey, don't you have any job, that don't you have anything to do in your time, go and make yourself useful. So first it was like weird for me why he's talking me the way he's talking. So one day what happened, when he told me to, when I was doing physical examination of one of my patient, he directly came to me and he was like, don't you know how to do this? Like, what did you learn? And I got so upset. And then I just, after some time, after finishing all the physical examination and everything, I came to him and I said, can I talk to you for a second? And then we talked in a person, and I said, if I'm doing some mistakes, please let me know, because I'm willing to learn more. And as you are my senior and more experienced people, so I want to have the opportunity to learn from you. So if I'm doing some mistake, let me know. I am willing to improve it. I'm open for any feedback you can give it to me, but please don't humiliate me in front of everyone, because it's embarrassing for me. And then after some time, I think he realized that, and we were in a good term after that. And we worked pretty good after that.
Well, that's okay. That's a good point. And can you tell me any few negative aspects of family medicine as a specialty according to you?
Sorry, can you please repeat the question?
Do you think there are any negative aspects of family medicine as a specialty? And if you think, then what are those?
To be honest, I didn't think of any right now. But if I have to say, then I will say about administrative work. Because being a physician, being a family medicine doctor, only don't have a work as a doctor. You also have to be an administrator. You have a lot of paperwork, and even after finishing all your doctor's duty, physician duty, you have extra 2 hours to finish all your paperwork. Without that, you are not done for a day, and which is very time consuming for most of the time. But I think it comes with every good thing. We always get some kind of bad thing too, right? So we can't do anything for this problem.
Okay, that's good. And because we have a lot of applications this season, so what do you think sets you apart from other candidates that we have?
Uh, First of all, I think everyone are good in their own way. But for me, I have as I have a lot of experience in my in clinical aspect. I have worked for 4 years back in my country, and I have volunteered for earth. I have volunteered in my country for earthquakes, so I know how to be a good leader. I have worked in a team because back in my medical school, I was leader for student association body of culture program, and I know how to manage time. I know how to organize. I know how to work in a team, and I know how to make schedule. Uh, and also we won 2011 culture program competition. Then in
Mhm.
my country, I have experience of conducting awareness program for small topics, and which I know that that is very helpful for long run. And I think I'm good at multitasking because because during COVID-19 period, I was studying for my steps exam as well as I was doing my duty, and also I was teaching yoga and meditation to most of my colleagues, and also I have one small institute of mine uh, back in my country. So I think I
Mhm.
can be good. I think I can be good candidate for your program.
Well, that's good. So, do you have any questions for me?
Yes, I do. Can you please tell me, except work, what do you guys do together?
Mhm. And any other question?
And also, I want to know that what is the inpatient and outpatient uh, transition system in your program?
Okay, that's a good question. So I think we're done with this. So according to me, so if you ask my feedback, so it's just purely based on my subjective feedback. So it was really good because you sounded confident in all of your answers, and all of your answers were like you were enthusiastic about answering them, and also you were answering them to the point, like not circling them around. But I would say like there were two or three questions where I felt
Yeah,
like length was, yeah. Hello.
repeating. I was repeating the terms and words again and again. I realized that while speaking.
Uh, well, I think there would be mixed opinions about that because if you do, then you will definitely sound natural. But because otherwise, if a person is just speaking in one go without taking out up the pauses or repeating the words, it just feels like the person is too much rehearsed for that. So, according to me, I would say like it's a good thing, but yeah, you have to like uh, cut them short in such a way that you don't sound like rehearsed and you also sound a little bit of natural, but you were definitely sounding a lot natural, so I would say like it's fine for me. But yeah, I would also love other people's input about that, what they think.
So,
So
what are the things I need to improve on? Any
yeah, so
answers or
yeah,
English
so I
or
would say there were three questions. Like the number one was tell me about yourself. The second one was when I asked you about can you share about one of your awareness program experience, and the third one would be this question about your strengths, like why we should choose you among all other applicants. So I felt it was a little bit like a stretchy, like in the
yeah.
end, answer was getting a lot stretchy. That initially you were maintaining the structure, like you were pinpointing the experiences, but at the end it got like a little bit blurry for me. Like I wasn't able to appreciate like what were
Yeah.
you gonna say next? So I would just suggest, like, before you say anything, like, signpost uh the listener that he gets to know, okay, the next thing is gonna come this, and this is gonna be the next thing. So just I would say, like, if you could work on these three questions, like just reducing the, like, for example, in your tell me about yourself, you can just tell two or three of your hobbies. You need not to list all of them, because later on you can always like add on to that answer. Like when they ask you, can you tell me anything except your CV if you want to discuss with us? So in that way, it won't get too much stretchy in the end also.
Yeah, that's right. Thank you so much.
Yeah, and about one of your answers on 5 to 10 year experience, I'm not sure about family medicine, but it was a little bit confusing for me because you said that you want to be a primary care physician with the part time as a hospitalist and part time as a private clinic. So I'm not sure like how family medicine works, but if it's that the way, then it's fine. But I was confused in that, like how it would work. Like you would be a hospitalist as well
Also,
as.
what I wanted to say actually, because I was not getting the word, I wanted to say that first I want to be a hospitalist, and after some time, I want to work as a primary care physician in my private clinic.
Okay, okay. Well, yeah, I think that's good, but I would suggest, like, if you could just remove this thing like saying private clinic, because most of the programs would say like if we would work for them only, like hospitalist.
Okay, okay.
Yeah,
Yeah.
I'm exactly not sure like how family medicine works, but I think that would sound a bit more in accordance. It would align more with them, because with the private clinic they might ask you something about follow up. So just if you don't land up in any kind of trouble, that would be my thing.
Okay, I got it. Yeah, thank you so much. Actually,
And
yeah, the
yeah,
questions where you were feeling I'm being a bit stretchy because I thought it was so sudden and I was just thinking about answers and I was like, what to say? That's why I need to
yeah,
prepare more.
yeah, and that was the thing I was also struggling. But I think when we are confused in any question, or we find a question that is like a bummer for us, like we haven't heard it before, always like just in subconscious mind, just always think like you have to be as short as possible, because you have if you have that kind of thought, you will come up with a short answer. Otherwise, it's a human tendency like to speak a lot more so that we could cover as much of it as possible.
Hmm.
So I think that's the one thing. Like if we think about like we're gonna speak a little bit about it so that we don't land up into trouble by because we have to come up with a spontaneous answer in that moment.
Yeah, I will.
And
Today I will
yeah,
work on. Hmm.
yeah, yeah. And the last feedback would be like in the conflict, some of the lines were like when you said that you've said to your sorry, to your fellow that you felt humiliated and you don't, please don't say like this. So I would just say like if you could revise those wordings, because it was kind of coming up too casual at that point of time when you were like stating that experience. So just keeping in mind like what professional words you have to use, like you can modify it in a way like uh,
Hmm.
in a way like just don't say like you felt humiliated or something, like a more casual word I would say in that place.
So I have actually one more experience where there was a real conflict. Can I say and can you improve? Like, can you say me tell me my any feedback? So
Yeah.
the scenario was while I was working as a medical officer, I met one new colleague of mine who always used to leave medical chart incomplete. Always like it's been a week and he never used to write history and the proper way the diagnosis and most of the things. So and also while doing handover he used to just give me like he used to give me the handover in such rush that something he is missing something. So it was an ongoing process and it happened for a week. And then I got one day I thought that no, this is not done, this is not the way he should do it, because he's not only hampering patients like patients what do you say description, but also he's not he will not be a good doctor like that. So I just met him in a person, and I told him, hey, everything is everything okay with you? Do you need help, do you need help with something in writing chart or in writing history or taking history? So he replied that due to we were in pediatric emergency, so due to workload, due to patient workload, he was so full that he couldn't get time to write history. So both of us worked on a plan after that, and then we made one strategy how to handle patients and how to complete the history taking and everything, because he was just new. So I taught him all the procedure, and after that he started writing history in detailed manner, and also he was giving handover in a good way. So how do you say that in a good sentence, if I have to?
So I think it's a good example, but yeah, if you can cut short it a little bit, so it is concise. So in that way, I think this would be a good example, according to me.
Because it actually happened with me, but when I was telling you the answer, again, this, because both of the thing happened with me. When I was new, it happened with me. When he was new, I was the one who told him to improve. So that's why I think I will tell this example better.
Yeah, I think yeah, if you just concise it, then it would be a perfect answer.
Okay, thank you so much.
Yeah,
Anyone
and
like any feedback? Yeah.
Yeah, I have one question from you. In when introduce about yourself,
Mhm.
did you mention about the what thing inspire you to be a doctor? You say everything, you travel and everything.
Yeah, yeah.
I didn't. I don't know. That's my sorry about if you heard.
No, no, no. Like the thing was, in tell me about yourself, I show them that while I was helping my father with his project of importance of girls educations, I learned, I motivated to learn how to serve and advocate for disadvantaged people. That means I was very determined for the serving and to advocate for disadvantaged people. That means our patient, and also being so this was the link to drive me how to become a doctor. So should I like do I have to mention also how why I'm choosing medical field in my tell me about yourself?
No, I'm newcomer. I want to frame my things, and I just asked because last 2 days when I joined to the group, I heard something like that. Because of that, I asked.
Oh, okay,
Yes,
okay.
Suraj, no, the Suraj, I think his name is Suraj. The previous one, Siddharth.
Sida.
Yeah,
Okay.
Siddharth. No, I just asked from you. I didn't heard that type of thing. Sorry, just my personal idea.
Oh no, it's okay. So do you have any feedback for me? Please tell me. I need to improve. I know a lot, but every feedback will be welcoming because my interview is very near and I need to practice a lot.
Mm.
I have one advice for you, just like because you sound like me. So maybe you can put your answer to any Grammarly or something,
Yeah.
uh, or Chat GPT, or sometimes Chat GPT will make it more like formal or more advanced. So ask him not to do that. Okay. And
Yeah.
then practice with that.
Yeah, I'm trying actually, but what is happening with me? It's like if I don't know the good words, if I don't know the professional words, and sometimes whenever I'm in the mood of giving interview, then I tend to forget all those important like words, and then again I come
Yeah,
up
it
with the
happens.
simple English. So that is my
Or
problem.
maybe you can just someone posted in group that give chat gpt like what are the buzzword for family medicine, patient care, or like family medicine practice. They will give some, and ask like chat gpt to give with some examples also. Then you can connect with that your like answers.
Hmm.
Yeah.
I think I will do
yeah,
that.
and I
Thank
think
you, Nivedita. Hmm.
yeah, and I think you need not to have like fancy words in your answer. The more
Yeah.
simple it is, and if you are more comfortable, like most of the time, I also
Not
speak.
fancy, just like holistic approach, multidisciplinary approach, continuity of care, this kind of things.
Okay.
Yeah, yeah.
Yeah. Yeah, Siddharth, you had such a good wording. I knew, like, when you were talking, you were so professional. I was like, wow.
And he was so confident also.
Yeah.
Yeah,
And
thank you.
also
So,
you're confident.
yeah, initially I was also struggling the same, but I think like practicing daily, it gives you some insight also, like where you are lacking. So I think that's the only key, like to practice daily. So you're mostly more confident with your answers and more like familiar with them.
Hmm. You're right. Anyone else for any feedback? If not, then again, two people can have their mock interview right now. Only one who is speaking here. So
I'll come for the mock interview.
okay. So anyone else want to ask Erica questions, or because I have already asked Siddharth? What do you want, Erica? You want questions from me or someone else? It's up to you.
Anyone is fine. Yeah.
Anybody is
I
fine.
don't know. Anyone is good. Yeah.
Okay, if no one is up, then I can ask you some questions.
All right.
Uh, just give me a second, okay? Because most of the questions I've already done with Siddharth. So
I actually didn't listen. I just joined.
oh, okay. So let's start from tell me about yourself. Hello. Okay. Let be professional. Hello, Dr. Jacob. I'm PD of this program. Can you please tell me about yourself?
Definitely. Firstly, thank you for having me here. It's an honor to be considered for your residency program. So my full name is Erica Jacob, and I come from India. My journey in medicine has been driven by a shared dream. Firstly, my parents, who come from a family of non-doctors, their desire to have a doctor in the family, and secondly, my own growing passion in this field. So I took my first step towards fulfilling this dream when I pursued my medical education at Christian Medical College, Vellore, and that experience was truly transformative, both academically and personally. Throughout my medical school, I was actively participating in volunteer services and community projects. And I was also discovering myself outside classroom by engaging in extracurricular activities like basketball, hiking, and dance competitions. uh, After medical school got over, I have worked in India for almost 3 years in diverse healthcare setups, where I continue to enhance my skills and my knowledge. And it also made me more adaptable to and culturally sensitive to the area. I first heard about your program through my medical school seniors who are currently pursuing their residencies here. And I got to do my 4 weeks observership here, followed by volunteer service at your program. And I was impressed by the emphasis on academics, the structured teaching and supervision you provide to your program. And I'm really excited to be here. So I'm really looking forward to meeting everyone after a long time and discussing how I can contribute to your team.
Yeah, thank you. That sounds good. Can you please tell me what makes you stand out from others candidate?
Thank you for that question. I I don't really consider myself special. I think the skills and knowledge I have is at bar with the people who are applying at your program. What I think really differentiates me is my attitude towards this profession. Uh, because I have worked in India for 3 years. I come from a family of non-doctors. So for me, it's not just getting be out there being a physician. For me, it's actually a calling, because my life journey has been like that being a doctor was something which was impossible for me. And I'm here. I'm very grateful for that. So I really want to continue helping people and serving the people, because that is what my medical school has taught me, not to be served, but to serve. So I think this is the motto which really differentiates me from other candidates.
Why do you think your journey was impossible to become a doctor?
So sure, I would love to discuss that. So so I come from a family of non-doctors. I'm repeating this way. Sorry. My parents. We are working class family, and they've whatever they've earned in their life, they've sacrificed on me and my siblings. And but again, I come from a middle class family, so it was not really possible for me to get coaching for medical school. So in 2013, when I graduated high school, I applied for my national entrance test like any other candidate who's appearing for medicine, and I could not clear it because I did not have coaching or right training to clear the exam. And that time my life, because everyone in my school who scored less than me in 12th standard, they were getting admissions in other colleges and other programs, but I had this dream of becoming a doctor, and that felt impossible that time, and I felt like a failure because I couldn't get a government seat, and private seats were really out of our reach. So I decided to give myself 1 year, and it was that whole year was so uncertain, and yes, I decided to give myself 1 year. I worked hard. I continuously prayed for this dream, and I finally got admission in one of the best medical institutions. So this whole experience did teach me that never give up on dreams. And yeah, it felt impossible in 2013. And for my family, it's a big deal for someone to become a doctor, and from that too from such a good college. So yeah, that was one reason that is one reason for which I say it felt impossible, and it was impossible initially.
Okay. Thank you. Can you please tell me why? Okay, one second. Can you please tell me about your strength?
Definitely. So I've been reflecting a lot on this question, and the quality which I think is my strength is that I emotionally connect with patients. I know it sounds like a weakness right now, but for me, I have seen my patients. I have worked in India for 3 years. I've especially worked in nephrology for 2 years. And after knowing these patients for months and then losing them, did leave a positive mark on me. And that always inspires me to do better in life. So that really gives me strength to do better. And I say that that is my strength. I don't want to forget their names, their stories, their faces, because this is what keeps me going. So yeah, this is my strength.
Okay. And what do you think your weakness will be?
Sure. So one weakness initially was, which I'm working on it, is that I get easily influenced by people. And this, I noticed this when I was in medical school, when I used to talk to people, and I used to make my opinion based on other people's opinion. And yes, so later on, I started realizing that everyone has a different opinion about everyone else. So I have started taking my time to know other people and then only give my opinion on them. So yes, this is my weakness, one of my weaknesses.
Okay. Can you please explain me something about your US experience?
Definitely. So I am very grateful. I got to do observership at two good hospitals, and then later on, I also did 3 weeks of observership at a private clinic. So I did my first observership was at Philadelphia at Albert Einstein Hospital. Because this was my first time in the US, I did not come with any expectations, but I was very warmly welcomed and respected, and I enjoyed my time being there. I saw that the residents, they are very professional what they do. Also, they're enjoying what they're doing. So, and again, the healthcare is not very different from the places where I worked in India. But again, the approach to a patient is different. The teaching is kind of different because here more emphasis is given on teaching and the holistic care. I was really impressed by the progress note documentation here because every and any and every symptom is noted and that is treated. So this is something which is really fascinating, I was really fascinated by this progress note documentation. And I saw the same thing when I was at SPOH. And yeah, it was wonderful to see emphasis on academic. I was very impressed again by the academics and afternoon session reports, when each and every test and every differential diagnosis we are making is questioned so that the resident actually learn. So yes, so these were my experience, and I'm very happy that I got to do observership at your program also.
Okay. And can you please tell me one interesting case that you met in your medical school or while your experiences?
Definitely. So, this patient has really touched me, and so I would like to share that this story. So there was this boy, 11-year-old boy, who had come to our ED in November 2021 sometime, with the status epilepticus, and his outside report showed shrunken kidney with creat of 10. So he was automatically admitted in our nephrology department. In India, the super specialties can admit. So I was on call that day. I took the patient to ICU. We intubated the patient and did 2 sessions of dialysis. The patient was sitting and talking to his mother. So it was magical for me to see. And then this boy was always scared to undergo dialysis because he used to develop headache. His BP used to fluctuate and used to develop headache. So he was kind of non-compliant with the treatment. So my whole team had sat with the patient and their parents to emphasize on the compliance part. But despite all this, the family was not compliant. So every time he used to come to our hospital in 20-30 days with same uremic encephalopathy, and he used to undergo dialysis and take DAMA the next day. So yes, and I remember the last time I saw him, he was undergoing dialysis, and I love kids, so I just asked him, so what do you want to become in future? And he was looking at me like he's telling, are you stupid? Because I could see the hopelessness and depression in his face. And yeah, we lost him after that. So it really touched me because when everything is available, the facilities are available, the parents and the family have money to do the treatment, still the child did not survive this. He succumbed to this disease, CKD. Yeah, so that is something which really touched me, and I really want to do better for these kids, especially yeah, these people who are compliant and still losing their lives. Sorry, who are not compliant and losing their lives because of non-compliance.
Okay. Do you have any questions for me?
Yeah, so can we skip this part? I still have to work on this question part.
Okay, Dr. Jacob. PD will skip this one. Yeah, okay.
For the mock interview, I have to work on it.
I know. Yeah, so we are done. And I just want to tell you that same here. I'm still facing how to structure most of the answers. You also have to be a little bit prepared for your answers and just put it in a structure, I guess, because most of the answers were I felt like it's like clustered. You want to tell the story, but it's like you are thinking too much. I felt like that. I don't know what others feedback will be appreciative.
Can you just specify which was it for every answer or?
No, not for every answer. The last two answers, and mostly I felt in this interesting case also.
Yeah,
you're saying like. And when I asked you what are your strengths, what did you do? I know it sounds like weakness, so please don't mention that word, because in strength no one wants to know what your weakness is, and like you don't have to say that okay, this you think this is a weakness but this is a strength for me. No, just if someone will ask you about your strength, just focus on your strength and answer focusing on that only.
How was the answer though? Emotionally.
It was good.
No, I like the part that you mentioned that it sounds like weakness, because some people really think like the emotion part is weakness. So I like the part you mentioned that.
Okay.
It depends upon everyone. Like I have
Yeah,
no
it's
right or wrong
perspective. Yeah,
answer,
it's
to be
very
honest.
subjective thing. I understand.
The way I present it, maybe that makes a difference. My non-verbal cues. I think
No,
that
I
will.
like because you were so natural and fluent also. I like the way you
You have a
presented
very
it.
good confident level. Yeah, to be honest, your confident level is really good. I
And all the
appreciated
time
it
you
before
were
also.
smiling also, so that
Yeah.
was also nice.
Yes,
That's
that is.
Thank you.
Yeah,
Dr.
that is
Jacob,
actually your quality.
I have a question. So for
Yes.
your strength, you say that, the emotional thing, and then for your weakness, you say that you get influenced easily. So, I'm thinking like it's essentially the same thing, that maybe you're very emotional and you get attached to patients, and then, or even people in general, and then they tend to influence you. So I feel like the bottom line is the same, and then what comes out of it, one thing is the strength and one thing is the weakness.
Okay.
So this is just my perspective. Maybe you can ask others. Secondly, I feel that you're speaking very fast.
All right. Yeah, I do that a lot. ठीक है.
And then, are you applying to peds or internal medicine?
No, I am.
Okay, so when you spoke about the peds case for CKD, there was a lot along the lines of I want to help kids, I want to help kids. So for a moment, I thought maybe it's peds because the follow-up question can definitely be if you want to help kids and you like kids so much, then why not apply to peds? So maybe just have an answer for that. And I felt most of your answers were actually nephrology related, and you did mention that you worked in nephrology, but maybe have like an example outside of nephrology as well, because internal medicine is everything. That
Yes.
was that. I did feel like some of the answers were really long, especially where you were telling the case. So maybe that's something you could shorten.
All right. Can we start?
Um,
Tell me about yourself. I mean, was that fine?
so I actually didn't hear you tell me about yourself. I'm sorry about that.
Sure, I'll take these points and work on it. Thank you so much for your feedback. Anyone else wants to give me a feedback? I would really appreciate it.
Yes, I'm also agree with the previous. I think Rina. I couldn't remember her name. Yes, I also thought you are going to apply for the pediatric.
Yeah,
Yeah.
okay.
Please.
For
Okay.
me, only like your pace was very fast. Otherwise, I feel like it was nice.
Pace was fast. Okay.
Hmm.
Yeah, all right.
Also, one more thing where you said that the kid was non-compliant and eventually passed away, if I'm not wrong, and you said that you want to help those people who are non-compliant with medications. I feel like the follow-up question could definitely be how would you address that? So maybe just have that answer too.
Yes, thank you for that. I will work on it. Okay, thank you. Anyone else wants to go ahead with a mock interview? I can take someone's. Join other groups then if nobody is conducting mock interview here. Better for us.
I meant was this residency, like this journey to this residency, the challenge you came.
To this residency as in before getting into residency
Yeah, this
as a
like
medical
the
student.
residency applying in US, the way through it, your USMLE journey, the challenge you came in through
Oh,
this journey.
okay,
But that's all
okay.
right.
Sorry, sorry, I didn't. I went somewhere else. So the challenge, yeah, challenge is like keeping myself motivated to continue the journey is something which I have overcome. There have been good days, there have been bad days. Uh, But with the bad days, I have realized that it's good to focus on the positives and keep working hard, and there will be light at the end of the tunnel. And I'm very happy that I pushed myself through this situation, and now I'm here interviewing with you, which is one of the best institute in the country. So it's something which I've learned in this journey.
Okay. Mm. So my next question would be, it's like kind of similar to the question I asked, but since you answered it very well, I want to ask this question again. So if you had to rank the characteristics in order of importance for a resident, how would you rank them? That is clinical knowledge, intellectual intelligence, social intelligence, and hard work.
Social intelligence, intellectual intelligence, clinical, and the hard work.
Yeah.
Um,
You have to rank in order of importance for a resident.
I think I would rank for a resident. He should be ready to work really hard. So hard work, he definitely needs to be very hardworking. What will help him in that hard work is his intelligence, uh, awareness of the field, intelligent person. If he has that quality, that will help him in doing the residency timely and efficiently. So that would be my second. Uh, Social intelligence, and the fourth one was
Clinical knowledge.
uh, social would come next. He should be aware what's happening around him. He should be vigilant. He should have social skills to handle colleagues, to handle difficult patients, to handle the difficult work situations. The social knowledge, and then clinical knowledge, he is something which not everyone comes in to the residency with. It is something which we learn on the way. So that is something which can come during the residency. So I would keep it last, and we can always work on that and add to it. So that would be my order of preferences.
Okay, good one. That was a good one. So, my next question would be, can you tell me about impactful patient interaction you have in your um, medical journey, specifically in anesthesia?
Uh, Impactful experience, I would think, with patient encounter, I would say when I was working in a cancer institute in India, uh, the way the patient used to be so thankful after their surgery. I could not think of one specific examples, but I would think that all those oncological patients which I've seen and we have treated, the way they used to be thankful and relieved post surgery, and the families used to give us the blessings, and uh, the kind of emotional outflow which used to happen. That was something I used to feel very rewarded as a physician, that I've made a difference in somebody's life. So those experiences of working in one of the oncological field, I really cherish, and I felt that I made a difference in somebody's life.
Okay. Um, okay. So, moving on to next question, Dr. Reddy. Um, what do you think of the US healthcare system, and how is it different from your home country where you were trained?
Uh, so US healthcare system, whichever I have seen, whatever I've seen till now, I feel it's pretty advanced. It is technologically and research driven. Um, it is of top-notch quality. Patient care is the priority here. How is it different from the healthcare I've worked in? So I have worked in a mixed healthcare system in India where there was a partnership between private and public, uh, where you can use the benefit of both kind of healthcare setup. In NHS, it was more universal healthcare system where patients which I was very impressed by. In US, um, it's again very top notch. The only thing is it's bit of insurance driven, and I see sometimes that patients not having the financial capacity to afford them, slightly being um, sometimes not treated according to a patient who has the capacity. But we have healthcare system. We have the options of Medicare and Medicaid here, which is mainly there to cater to that kind of patient. So I think each healthcare system has their own advantages and disadvantages, and I think American healthcare system has its own advantages.
Okay. Okay, that was a very good answer. I can relate to the differences between a third world country and US. So my next question would be, what do you think is the most important medical invention or discovery till now?
Wow. Okay. Uh, that's a very interesting question, which I haven't thought about. But I would say the discovery of surgery by Shushruta in, I don't know which year, before Christ time, which led to the, I mean, uh, if the surgeries were not discovered, people would have not been able to heal themselves from so many conditions. And I think so the discovery of surgery by him made a big difference in the way healthcare system works.
Okay. Okay, I can understand. Being an anesthesiologist, that was your answer.
Yeah. Yeah. I
So,
don't know. We should come up with better answers. You guys have some suggestions? Antibiotics? I don't know. Anything
uh,
else
think
which we can
as I'm
say?
applying to internal medicine and pediatrics, I also haven't thought about this answer, but I would say stethoscope.
Okay. Yeah.
sorry, what did you say, Alisha?
I would say stethoscope.
Oh, nice.
Yeah.
I think I would say would be anesthesia, because I think anesthesia is the latest discovery in the field of medicine. It is the newest stream. So
Mhm.
I would say this would be like I'm saying to Riddhi, like if I had to say, but
Yeah.
even what you said could be related to your like stream. But
Hmm.
Hmm.
what I feel is
Yeah.
like when the patient, because since surgery is being going on since long time and people had to like because of this pain management and pain during the surgery, the discovery of
Yeah.
anesthesia is something which which I find is like very fascinating and very, you know, like a big discovery in the field of medicine.
Yeah, since you are
Right.
applying for
Yeah.
anesthesia, I think saying that would make sense.
Hmm.
If
Yeah.
I say stethoscope, then I can say that we can use it to listen heart sound of patient, and it will help us to diagnose different condition. I think that would sound more interesting in medicine, though I'm not sure.
Sure.
I'm so sorry to interrupt.
Yeah.
Yeah. Ishan, Ishan, can we meet in room 10?
Oh, sure, sure.
I just texted.
Yes,
Yeah, you
Ayushman.
continue. Like, I'm so sorry to interrupt. I just texted him. He didn't listen, so I had to come here. I'm
Oh,
so sorry.
sorry, I didn't get your text. I'll meet in room 10. Hey, Riddhi, I just had a suggestion for you. Your answer about the challenge you're facing anesthesia, I think.
Challenges of,
Hello.
yeah.
Yeah. I don't think you should mention the about the nurses, the part about the nurses, that the responsibility given to them and all of that stuff. It, I mean,
Yeah.
I'll
Okay.
I'll talk to you later, but there's just a suggestion. I'll just meet Ayushman and come back.
Sure. Okay.
Yeah.
Fair enough.
Okay.
Yeah.
Yeah, so even I was about to give you that at the end of the feedback,
Hmm.
Dr. Riddhi, because
Yeah.
see, that is I have talked to anesthesiologist here. That is actually a concern, to be honest. But
Did he say room
Mhm.
11? I'm sorry.
I think
It's
10.
at room 10.
Oh, sorry. Thank you.
so what I would suggest is not to get into some conflicting topic,
Okay.
you know.
Right. Right.
You
Right.
see, I know they're like in US healthcare in an anesthesia that is a very
Big concern.
that is the concern, but that is also a very
Yeah.
conflicting topic because there is already a scarcity of anesthesiologists and they are covering it for up.
Yeah.
So it's better you don't raise any conflicting topic.
Okay. Yeah. Sure. I get that.
I think we have so many other challenging things in anesthesia.
Like what would you say?
Um, and one more thing, since this came up, I would say it right now. One thing what I felt was what you said
Yeah.
was the people and the surrounding is not very much aware of anesthesia, and like We don't get
general
that's where
general population. I mean, the importance of anesthesia is coming up, but still people don't know about the things which we do apart from putting people to sleep.
yeah, I can, like coming from the third world country, I have also been a practicing anesthesiologist in my country. I am like a third world
Yeah,
country, but it's
yeah,
very much relatable there. It's actually in like a fact, but I don't think people would be like able to relate this in US
yeah.
because
Okay.
as much of my clinical experience, I think people are quite
Hmm.
aware about anesthesia here.
Okay. Because I have seen even educated people, my friends who are non-medical, they still feel that we are being paid for just putting to sleep, and I it just infuriates me. I mean, I'm just doing this off topic. I won't say this to the interviewer, but I still feel people just think that we are there in theater and putting people to sleep. I still feel
Okay.
that. In my,
Might
like, it could
that
be
might
my
be true,
personal
but if you
experience.
felt so, I think
Hmm.
you can say it, and like you can get like follow-up questions in that as well. So if you're prepared,
Hmm.
that's well and good.
No, but if yeah, that's a very good point that people don't feel it that way here, so they might not relate to my answer. So I need to change it. I can do that actually. I
Yeah, so I
but
think it depends.
okay.
I think it also depends on the like. If you could mention me the state where you got the clinical rotation in anesthesia.
Virginia, it's not about that work work set of people. It's just the friends and family around. General population who are not doctors. Among doctors, they realize the importance of anesthesiologist.
Mm-hmm.
Uh,
But
both,
actually, why I'm
yeah.
saying this is because I was really surprised. I did my clinical experience in Colorado. Like, I didn't do
Hmm.
much. I just did 2 months, and like two
Yeah.
months in two different hospitals and two different cities. And I was really
Yeah.
surprised because from where I come, I had like I wouldn't expect this much to like patient to know, and I have to explain much more. But I was really
I
surprised the
see.
patient I'm talking specifically about patient, not the medical faculty and all. And the patient were quite aware and they know it, and they were
Okay.
like they know
Okay.
about the medicines and they know about the complications and everything. I was really surprised. So even I thought of
Right.
it like if I would had to say the challenges, I would have to say this, I but after my clinical rotations, I thought the scenario is different here.
Okay.
But it might
No, I
not be
should change
true
the
for
answer.
all the
I'm
like
happy to
all
do
over
that.
the US.
Yeah, but I get the point. It might not be.
Yeah, I think that would be safe to like, to say something which could be like everyone could relate to.
Would be your answer for the challenges of
Honestly,
anesthesia?
really, see, I have not prepared my answers. I am still just collecting the questions and like getting to know everything. I have not finalized my answers yet. So maybe in few days I'll be able to tell you.
Sure. We can, yeah, we
Okay.
can come up with a good answer for this.
When is your next interview?
So my next one is on third, but it is prelim. So I think they won't ask me that much of anesthesia question. Hopefully not. They'll ask me more medicine.
Oh,
Uh,
okay.
but I have another one coming of anesthesia. So hopefully before that I should or we should have some answers
Yeah, sure.
first.
Okay. So let's move on to I think we are done with the like now let's go on to some fun questions and like this kind of questions. So what I would ask is, mm, if I write a biography about you, how would you like me to title it?
Uh, I would say unfinished since I'm an ongoing process. I never stop. Uh, I think I would name my biography if given that kind of opportunity to be titled unfinished. I think I've taken. Yeah.
Okay, that was a good one.
Thank
So
you.
one question. Um, since regarding your USMLE step score, if you have to repeat your exams again, do you think you'd get the same score, or better, or worse?
Uh, if I have to give the exam again, I think I gave the exam in the optimum situation and with my best of capability. So I'm very thankful for the score I got. There's always you can improve on, or you can work on your things, but there could be things which can go wrong. Uh, so it will depend on the situation, what kind of mindset I'm going into the exam with. It's not always good to take so much time and keep on postponing. So I would say my scores were better when I gave it rather than if I were to give it all over again.
Okay. You said you'll get better score, right?
No, I think whatever situation I gave it in, it was good only, and I think I was happy. So I would not think that my scores would be better the next time.
Okay.
Yeah.
That was a good answer. So, one thing I would like to know is, who is your idol in your life and in your specialty?
In my
And if
life,
it's the same
uh,
person, you can say it as well.
I wish my mom was not an OB and an anesthesiologist. I would have said the same person, but she's an OB, so she's the idol man in my real life. She, yeah, she's someone I look up to. I'm sure many of us have their moms as their idols, but I would have to have the same answer. Whatever she has done in her life, and the way she has handled the work-life situation, I think I would like to imbibe her qualities to be a successful mother, clinician, daughter, and in every which way she has performed. In the field of anesthesia, uh, my idol at present would be one of my attendants from Tata Memorial in Mumbai, where I worked with. She was a kidney transplant recipient, and she was on lots of immunosuppressants. But the way she used to work, the way her enthusiasm for life, her patient care, her emotional quotient towards her patient, towards her residents was something which was very awe-inspiring for us. And I always used to look up to her, how positive she is in life and how well-rounded personality and a physician she is. So she's my current idol.
Okay. That was a really good answer, Riddhi. And one thing I would like to ask more about is, what are the things, or it could be one thing as well, would you like to change about yourself?
Trusting people very easily is something which I'm working on. Um, uh, I would like to work on that and take my time before trusting people. Um, not heavily relying on others. Uh, for the work or something. Oh, sorry, I want to change the answer. Yeah, trusting people easily is something which I am working on and I need to work more on.
Okay. So one more general question. What's your spirit animal?
What do you mean by that, actually?
It's like someone you can relate to, or someone you see yourself as, or someone you want to
I
be.
see.
Okay.
I see. Um, I think I would relate to a bunny who is happy in himself, not bothering, is a loner, enjoying his time in garden, eating his own stuff, and not bothered by the surrounding. I I think, yeah, and people say I look like a bunny too, so maybe my spirit animal is a bunny.
I am actually looking for the meaning of spirit animal because I think this is a common question to be asked, and I don't know the exact meaning of this.
Oh, yeah, I'm not aware of it too.
Yeah, I saw in one of the YouTube videos, and they say that it's a very common question. What is your spirit animal? So now I'm checking what does it mean. In Google, it says, I don't know. If somebody knows, please let me know. Can you please tell us?
Oh, it says spirit animal refers to a spirit which helps guide or protect a person on a journey.
And whose
So it's more
characteristic that
deeper.
person shares.
I think what Sonal said earlier, that's actually what they're looking for rather than this spiritual aspect, in my opinion. They just want to know if you could, if you relate to some animal, what would it be and why, what kind of features
Okay.
you find
Okay.
similar. Yeah.
Not in a very serious way, right? Or it's like
Yeah.
spiritual, deeper connect.
No, I don't think that's what they're asking about. They just want to know what kind of similarities you find in in this
Okay.
specific animal. Yeah.
Okay.
I think the same. Yeah.
Okay. So I think I have asked a lot of questions to Hriday.
Oh
That must
yes,
be very
Sonal.
exhausting for you.
No, thank you so much for exposing me to so many questions. I mean, yeah, I needed some practice. Thank you.
Yeah. So my last question would be like, it's a question for me actually. So do you have any questions for me?
So if you're a PD, I would ask what kind of qualities you are looking into a potential applicant, successful applicant for your program.
Okay.
And how many of them do you see in me?
Oh, wow. That's a good thing to ask. Like you can know by then only what are your
Yeah,
chances.
I should rank you or not.
You are very smart, Hriday.
I don't know if I should talk that much. They might find me this girl is not serious.
Yeah, I also felt that in your answers. I felt like you are a little too honest, which can be a good thing,
Mm-hmm.
actually, which can be a good thing. But like as I said earlier, I'm going to my feedback. Actually, I'm done with my questions.
Yes.
Like, don't go into any conflicting topic, you know?
Right.
Yeah.
Yes,
That like
I
the
totally
way you
agree.
said, like you said that the
Hmm.
people are not very aware of anesthesia. That's all right because you felt it. You felt it in the
Mm-hmm.
population among here. You felt it. You will be if you come to a follow-up questions, you will be able to answer
Yeah.
it. But when you said
Mm-hmm.
about the CRNAs, and that is a very conflicting
Hmm.
topic, to be honest. I don't think you should go there.
Yeah. Right. Yeah, that's a good feedback. I mean, if I think that if you're talking to anesthesiologists, they might relate to it, but maybe in general scenario, if CRNAs are around, they
Yeah,
won't
see,
be
if you're talking
comfortable
to an
discussing, right?
anesthesiologist, that's okay. But you never know. You are talking to a program director. You are talking to someone who
Mm-hmm.
is in the field of, like management. So it's like they may be managing the CRNAs as well.
Right. And they might be in more positive side of CRNA's aspects
Yeah,
than
exactly.
I am,
So what you
maybe.
see
Right.
is like the CRNAs in this country, they are giving the anesthesia. They are providing
Mm-hmm.
anesthesia in the places where anesthesiologists are like scarcity. There is a
Got
scarcity of those places. They
right.
are like covering for
Hmm.
us. So
Yes.
people can have different opinions.
Right. I totally get it. I mean, there's no doubt that it's a controversial topic which I should not step into.
Yeah. And one more
Sure.
feedback if I have to give to you is your answers, what I felt, you have the answer. The best thing is that you have answer to any questions, because I asked this question because I used to feel like I before you I did it with Alicia, and like she also, like, she's very well prepared. Her answers are very, very like concise and perfect. But when it comes to new questions, everyone get to
Hmm.
stumble, or they get nervous. But you handle
Right.
any new questions very well. That is a very good quality, honestly. But what I felt is,
Yes.
what I felt was your few answers were not very
Hmm.
catchy.
Okay.
So you get like
Sure.
you have answer to any questions, but I would suggest is like few general questions, like common questions, is if you could prepare a little bit more in those questions.
Right. Do you remember like one or two? Which
Honestly, I felt it in few questions, but like I don't remember
that's
it
fine. That's
now.
fine. You asked so many questions. Yes.
Yeah,
I
I
agree.
asked so many questions and I didn't get
Yeah.
to like note it down. I should note it down
No, no.
actually, to be specific.
I didn't
But
know.
what I
That's
felt
too much
was
to ask. Yeah.
what I would suggest is few questions that like there are few questions which is like there is a maximum chance you'll be getting asked those questions.
Mm-hmm.
It would be better if you could, work more on those questions. But like I said, the best quality I felt about you was I think if you'll be asked any new questions, you'll be able to handle it.
I think she's left the meeting.
Oh, okay.
Organization that some of my family works with in Kashmir. Um, so I have always actually wanted to go back for just for a short period of time to give back to my people. But other than that, like I wouldn't. I guess
I wouldn't
obviously
give
I'll
a
be
firm answer.
Is this question means like are you gonna go back for visiting or for volunteering, or means are you gonna like specialize here and then go back to your country? Like means like
Yeah, go
go
back
to work there.
completely. Some people
I mean,
just
yeah,
want to
I
come
think
and get the exposure
that
and go back.
yeah, I think
But
what they
from
mean is
what I've been
obviously
hearing,
if you would go.
sorry,
Sorry.
but from what
I
I've
think
been
we can.
hearing,
I think we can keep.
yeah,
I don't give a firm answer saying I would like to go back. Say
yeah, from what
I'm
I've
keeping
been
my
hearing
options
from
open, and
people, they will say, don't mention you want to go back.
yeah,
Say you want to stay here and
don't make
work
it sure
and
exactly.
maybe give back to the community or whatever. Then maybe you want to like maybe you still want to like have connection at home, like maybe um contributing positively to the development of your country, maybe particularly within the health sector. Then anything that you can contribute, not going back. Maybe contribution is good because they will expect you to like, as in that is where you grew up from, that is where your home country is. You should participate
Exactly.
in one way or the other, but you should not
Exactly.
say you're going back home.
Yeah,
I have
and
an answer option for them.
you should
Sorry?
not underestimate your country in a way. You should not let them feel
Exactly.
that you don't appreciate your country or what your country gave you. But on the other side,
Exactly.
you want to stay in the US, and as they mentioned, yeah. So yeah.
Can we say like that when my vacation period, I would like to go for some volunteer work with some organization to help my people and give something to my people especially in the rural area. Can we say like that during my
Very
vacation
good.
period?
Yeah, it's good.
You
Yeah,
can, but the question was, would you move back after residency, right?
after I
So,
say, okay. Yeah.
I didn't get you. Can you
sorry.
repeat it?
No, I think the question was, after residency, would you like to go back to your home country permanently? Is what you were saying, right? Did I get
Oh,
it?
they didn't really specify if it's permanently or not, but of course, if they do specify it permanently, then we can't say any of the volunteer or anything, right?
Yeah.
Yeah.
If someone US citizen sorry, US citizen or permanent resident can go their back country, but US citizen people, they cannot go their back country permanently, I think so. Can we highlight that I'm a US citizen now and I don't want to go permanently, but I would like to go in the vacation period to give something to serve some way to my people in my back country. Is that good?
Yeah, you can
Yeah,
say
I
that.
think Yeah, I think maybe if they do ask, even if they ask, would you like to go back permanently, you can start with maybe that you have strong family ties in America, and considering that your family lives here and you're a citizen, you don't think that you would go back permanently, but I would like to give back to my society by doing volunteer work in the time that I have apart from, my clinical or apart from residency or it's after residency, right? So like in your free time, basically. So maybe that's how we can kind of put in both aspects where you're giving back to your country and you're not really, disowning the place that you come from, but at the same time, it's unlikely that you'd go back considering your family is here now.
Yeah, that's great. I think that's perfect.
Mm-hmm.
If I can say that I like all the ideas, and as you all guys mentioned, we can contribute in many ways by donating our time, donating our money through like organization, as the doctor said, to help improving the system or the health system in our country. We can do virtual training for new generation over there. These are all things that we can add. If you are done with this question, I want to see if you guys have an idea of how to answer why US. Why would you like to come to do residency in the United States in general? What would make a strong answer?
Chasing the American dream. I think to answer that, like you can tell, like you can say, like because America is really advanced in the medical field and it has the biggest, like make it all about medicine, and at the end you can say like I'm exposed to a lot of diverse cases and stuff like that.
And another thing, I have a family here. We moved all together, and like like those kind of things. Like I have support here in Canada, in the US. And besides, like as Dr. Rizet said, it's considered like one of the best places all over the world regarding like medicine, technology, like advanced in everything. So.
Thank you,
Is
everyone.
it okay to mention first family, then the knowledge, advanced knowledge? First, we have to highlight that America has a sophisticated medical medical knowledge and the technical things.
Yeah, I think
Is
you
it
should
mention the
mention those
medical
ones
aspects first and then the
before
family?
Yeah, I think the medical aspect comes first.
Okay. Yeah. Yeah, thank you.
I was actually speaking to a resident about this, and she suggested actually, depending on your family ties, you should mention those because generally, you would, if you have a very strong, it also depends on what your family ties are, right? Like if it's your spouse or if it's your parents, then that's a way stronger tie than a relative. So in that case, I think you would mention your family first because it seems more genuine, obviously. So.
Yeah, and more specific, to you than others,
Yeah.
maybe.
Yeah.
So we've only, apart from family, we've only said two things: advance in medicine and technology, then exposure to diverse cases. So are there any other points?
Sorry?
Are there any other points apart from those two?
I would like, it depends where you get an interview. If like it's in a certain like a state or a certain city that is the main attraction for you, I would just go online and find a certain attraction and add it at the end to make it a little bit like it reflects how fun you are, how adventurous you are. So try to add that. If it's a city that you like or something attracts you there, you could put that in at the end too. Because everyone is going to say the same answer. So don't make your answers all cliche. Just add something at the end. And yeah, this is what I would do too.
Beside, I can say, for example, that I visited the United States like 10 years ago or whatever, like in my last visit to the United States, I really, as the doctor said, like the city. I really like the experience, and I wanted to pursue my dream here. But then when I came and I saw this country, I was fascinated by everything it has. So I wanted to be here. So that's why I started working on my USMLE journey and blah blah blah. So I think this could be also something, if you visit the US before and you liked it and you have an experience before to speak about, in the US. Or
Yeah, that's a good
an observership or externship, whatever, like something that you really liked, and or work, research, whatever,
Yeah, that makes sense. What about talking about evidence that they practice evidence-based medicine here? Then maybe the research and innovations.
Yeah.
I think those are very. Yeah, but at the same time, you want to make your interview as personal to you as possible,
100%.
because you only have 20. Sorry.
Yeah, 100%. I'm saying.
Yeah.
Yeah, I agree.
Yeah.
Yeah.
Yeah, so if these keywords like evidence-based and all of these, there's going to be thousands of people using these. So if you can, I would say that try to pick out the one thing in your CV that you can relate to the area maybe, or your family, or something that personalizes it, because it's only 15, they have like 20 minutes to get to know you, and you don't honestly, like, you don't want to waste any of those 20 minutes giving a generic answer. So that would just be my take. But obviously sometimes we don't have anything to say, and then in the moment, keep that as a backup. Like in the moment, if you don't know anything to say, then you have to say something, right?
Yeah.
But yeah, while you're practicing, just try to make it personalized to you. Yeah.
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 Go ahead.
What is your motivation or inspiration to do volunteer service?
Nice. I can answer this. Maybe it's not the best answer, but just like to try,
Okay.
For me, I really have a good experience in volunteering. I have over like 10, 15 years of volunteering, because I've been doing this since I was really young. And it's part of my life. It's kind of like part of my daily life. I can't like live without it. And it's the thing is that and it's my own personal opinion that I believe in giving without a return, without like waiting for a return. I really believe in that, and that's one of my like perspectives in life. So I, as much as I give without waiting for a return, I feel relieved. I feel less stressed. I feel happier. So that's why I try to save up that time for anything that I can like give people or do for people or for the community or for any body that needs, yeah. And I like as I said, since I have really a good experience in that, like I whenever I do something, I volunteered as as a leader for like a scout group in my country, and I was like leading almost like 150 person in that group. So I always felt happy whenever I got a positive feedback from those people that I'm working with or we're like together, you know, like, and whenever I feel that it was a youth group. So whenever I feel like whenever I see those children are happy, are like able to come to participate in their communities, able to speak, you know, to speak up, I feel really satisfied, and I feel that I did something very good. So it's kind of a stress relief for me, and like kind of a way that I escape from whatever things I have, like whatever like complicated things I have in my life. So I don't know. It needs to be polished for sure, but I'm speaking about like a real experience. So that's I don't know.
Yeah, that makes sense. I like the fact that you mentioned that you like giving without expecting any return back. Yeah, that makes sense. I really like that point. Yeah. But it's kind of long, like you said, if you kind
It
of
is long. It is long. Yeah.
yeah.
But that's the first time for me answering questions. So I'm trying to just like speak up whatever I'm thinking of, like speak out loud, and then maybe I need to sit down and polish everything, you know, to
Exactly.
be
That
really
makes sense.
precise and smooth and small, and yeah, that's right.
All
I don't
right,
know
guys.
any
I
other
think I have.
answers. Any other? Yeah.
No, I was saying I have to leave. So thank you for this session. I'm sorry I can't stay for more time, but
Yeah.
it was great meeting all of you. Thank you.
Yeah. Thank you.
Yeah, nice meeting you.
Any other suggestions, guys, or we should stop, whatever you'd like.